Hello there, my name is Julia. I'm a birth doula and hypnobirthing educator, and I'm here to support you in your pregnancy, birth, and beyond. Today, I'm going to talk about some myths and misconceptions about unmedicated birth that might make it easier for you to decide what you want to do in your own birth journey. The first myth, birth is too painful to handle, or I don't have a strong pain tolerance. I hear this a lot. Almost all of my clients come to me saying, I stubbed my toe and I'm on the floor for 2 hours. That is very, very normal. You are not alone. People often assume that unmedicated birth means unbearable pain for hours, if not days, when that's just not the truth. Labor can be uncomfortable and it can cause a lot of increased sensations, but it doesn't have to be excruciating pain, and it's not all at once. Your body is designed to handle labor, and with the right tools, many women find it more bearable and not as unbearable as they thought. But the coping strategies that you can use, like breathing, movement, mental focus, will really help you go through each surge. And when you think about it, it's not hours and hours of excruciating pain. Maybe it's 60 seconds of an intense sensation, and then you have 4 minutes of rest. When we break it down, it's a lot more manageable. Plus, with an unmedicated birth, your hormones are flowing, oxytocin, endorphins, that help you manage those intense sensations. So yes, it could be intense, but it's not impossible. Another myth is the idea that with an unmedicated birth, you are just left alone. Grin, bear it, deal with it, with no support around at all. So while yes, many women who choose an unmedicated birth feel very secluded and want to go within and don't want any distractions, that doesn't mean that you aren't supported. With the right planning and support around you, whether that's your husband, your partner, your mom, a doula, your midwife, everyone around you is there to support you. Think of your support team as your cheerleaders. If you're hiring a doula, it's like hiring your best friend. Make sure that you feel very comfortable with whoever is going to be in the room with you. Yes, birth is about the physical task of birthing your baby, but it is the emotional, spiritual, and mental piece. A lot of times my work as a doula is to just sit and observe, not to necessarily be doing. That's who you want in your birth space, to help protect the peaceful environment that you have already created. Myth number 3, unmedicated birth takes longer. The reality is that every birth is unique and every labor looks different, and that includes timing. The length of your labor really depends, and it depends on a lot of factors. How safe you feel, how protected you feel. Do you feel supported? Do you feel like you have to perform? Are you on a clock? Do you feel like you are being judged? A lot of these things can quicken your labor or they can slow it down. Research actually shows that unmedicated births do not tend to last longer than medicated birth. Myth number 5, unmedicated birth is dangerous. The truth is that unmedicated birth is just as safe as a medical conventional birth. Our bodies are perfectly capable of laboring and giving birth and birthing the placenta, and have been for centuries, millennia. It's not something that suddenly became dangerous because we started using interventions and having a more active management of labor. Women have been giving birth without medication long before modern interventions were readily available to them. And with the right care, it's just as safe today. And the last myth today is that unmedicated births are only for home or birth center births. Yes, hospitals are full of interventions, and I would say a majority of women who are birthing in the hospital tend to have a medicated birth with an epidural. But you can still have a beautiful, unmedicated birth within the hospital setting. It's all about working with a provider that you trust and supports your belief in an unmedicated birth. Creating a plan, working with them, and clearly communicating exactly what it is that you want. Might be more challenging, and there might be some times when you're like, oh, should I just give up? And I found that even the strongest, most willed woman wanting an unmedicated birth can waver, especially when she's in the hospital and it's an epidural is right within her grasp. But just because it's there doesn't mean you have to use it. It's all about setting the tone for your experience, having your providers, your support team on the same page as you, and really understanding your why. Why do you want this unmedicated birth? A lot of women who are planning for an unmedicated birth don't want to be in the hospital because they don't even want it to be an option. Because if they do have a moment of weakness or feeling like they can't go on, they don't want that to be an option. And when you're in the hospital, it's more likely that you will gravitate towards using medication. For a lot of my clients, I come up with a safe word, and you can say you want an epidural all you want. You can just say you want it, but until you use this word, we know not to offer it to you. That has been a really good balance with my clients so that I feel like I'm giving them the exact support that they need and not offering something that they don't want to be offered. With the right prep, care team, emotional support, you can have an unmedicated birth within the hospital. Yes, it might be a little bit challenging. You might have to jump through some hoops, but if you're feeling strongly about it and feel convicted, you can absolutely do it. So there you have it, some myths or misunderstandings about unmedicated birth. I hope this video helped you have a clearer understanding of what unmedicated birth is like and if it's the right decision for you. Remember that every birth is unique and yours is no different. And make sure that you have the support that you need to have the birth that you want. See you in my next video. Bye.